Good morning, everybody. Welcome to St. Louis Providers. Today, I would like to introduce Bridget Kiely. She is doing some amazing work with young adults, children, and she really focuses on helping people who may have eating disorders, maybe some people that have harmful disorders, but really at the basis of all that, it's about helping people through stressful situations. She's a therapist and she does a lot of behavioral work with people, and she does like 8-week courses at her clinic that kind of evolve and help children and their parents learn how to get through some of these stressful situations. So let's dive into what she does to help people and how she can help you today. So Bridget, just say hi and tell us a little bit about yourself if I missed anything.
Yeah, hello everyone, and I'm super excited to be here. I've known Donna for a very long time, and I'm looking forward to connecting and expanding our professional life as well. Donna said it pretty well. I am a behavioral therapist. I contract through St. Louis DVT, and I also have my own practice, Bridge the Gap Counseling, and I work with kiddos to the adult age. I love working with parents and families as a whole unit to create a change-ready environment at home and figure out skills to use in all aspects of our lives, because we need a lot of them sometimes.
Isn't it the truth? Yeah. So like kind of diving in, I feel very passionate about stress. I think it's something like 1 in 4 people are on antidepressants. I feel like 80 to 90% of the people that walk into my office as a provider is stress related. They think it's headaches. They think it's GI. They think it's acid reflux. But at the end of the day, a lot of times these things are really built in stress. So could you just speak a little bit to our emotions and that stress response?
Yeah. I've seen it personally and even professionally, like how that stress, can affect our body. And a lot of times we don't even know it's that stress. It kind of tucks itself away somewhere else and pops up and shows up as something we're like, okay, this hurts. This is uncomfortable. I don't feel like myself. And so we often see that when we get into a crisis. Like a crisis is anytime we either don't know what to do or we feel like we don't know what to do. And we have a lot of modern day stressors like traffic, arguments, deadlines, homework, whatever it may be, that kind of activate that sympathetic nervous system. That fight or flight response is what we more commonly refer to it as. And, our nervous system has 2 parts, and they actually work in the opposite direction. And so when our sympathetic nervous system is activated, it's how our body responds to stress, to danger. It's automatic. It's fast acting. It kind of just shoots out.
I feel like it's like this.
Yeah.
There's nothing going on. And on the inside, you're like, it's like out of control. I'm telling you, out of control. And I'm sure many people can really like, so yeah, that's how I feel. So anyway.
And then it's all like shooting these, hormones into our bloodstream. And that is doing fast acting things, like affecting our digestive system, making us tense, making us more aware, which does serve a purpose sometimes. But then is slower acting and affects our immune system, which we see that's kind of where those, stress responses come up, and that more long-term effects that it has on our body, not just mentally and emotionally, but physically.
Don't you think that's kind of like that inflammation? Like inflammation is things that eventually cause disease. Like I feel like inflammation is kind of like the basis of a lot of disease. So it's interesting. But some people really, instead of developing disease, develop some behavioral issues, like what you do with eating disorders and harming yourself and things. And so kind of speak to how do we turn that craziness, like what do we do with that?
Yeah. And so when we do have, let's say a prompting event pop up, a trigger, aka life, we automatically have like 2 responses. We either tolerate it or we're like, bye, I don't know what to do with this. And we escape or we avoid it. And depending on how we respond initially, and again, emotions are generating pretty quickly. It's not like we're having like a day or so to think about our response. We often will get stuck in this avoidance paradigm. And we're doing that because we're trying to escape the emotion, and we maybe act on a problem behavior. Maybe that's eating an extra piece of chocolate or another cookie. Maybe that's staying on Netflix too long and avoiding doing something that's daunting to you. Or it could even be, you're harming yourself to kind of get rid of that pain in the short term. We can see that come up with substance use, with eating disorder behaviors. And just it really goes down to, people. And I have been in different situations in my own life where we don't feel like we have the capability, or we actually don't know what to do to solve that problem, AKA finish out that emotion that's causing us so much distress. So we do end up getting short-term relief, but then it's making us more vulnerable to that cue the next time that it happens.
So is it kind of like a revolving, like the stress comes, you don't do it appropriately, and then it comes again, and it goes higher because you haven't learned to cope with it? Is that kind of what you're?
Yeah. Am I able to share my screen? Oh, I cannot, Donna. I was going to draw that out for you, which I can maybe do so on this piece of paper here.
Yeah, that'd be good.
Yeah.
I think some of this is embedded thoughts from our childhood. Are they, emotions that got stuck early on?
So I would say, we essentially learn to cope in like our beginning years of life, think from a young age, our parents and like the people we look up to. I know I always thought like my older cousins are really cool, or my parents' neighbors that were young, but like we essentially are looking up to people, they're modeling stuff, and we essentially have these learned behaviors. And they're kept around because not that anyone overtly taught us, oh, when you're stressed out, eat some chocolate chip cookies. Like no one teaches you that, but it's kept around by, reinforcement. It's kept around because it either helps us, maintain something that's desired, or escape or avoid something that's undesired.
Yeah. So isn't that so interesting? Let's see what you have there. This is
Yeah.
fun.
I'm about to finish my last little piece of the cycle. Okay. So let's say we have a cue, AKA known as life, a trigger that automatically leads us to a negative emotion.
Okay.
Then we're like, oh, don't know what to do with that. We avoid. It leads to that problem behavior. We get a little bit of relief, but then the next time that cue or that emotion pops up, our vulnerability goes up.
Huh.
And so we kind of get stuck in that cycle like a hamster wheel.
Yeah, I feel that hamster wheel.
I'm thinking of the wheels I'm in currently.
Yeah, it's a pretty wheelie up there.
Uh-huh.
I think about a lot about how these emotions are first generated. And I feel like, I feel like I'm 57, and I feel like sometimes my coping patterns right now don't seem like they're as efficient as they were when I was a little bit younger. And I don't know if that's just because the crises are different, and like I'm doing an avoidance, like you're saying, and then I'm hitting this, I get the negative, and then I hit avoidance, and then I'm going into, well, I'm okay for right now, but I really didn't do anything. And then all of a sudden it's getting bigger. It's kind of like that circle that you're talking about.
Mm-hmm.
Yeah. So what do you do?
So we have to tolerate it, which sounds really daunting.
Who wants that? Where's that magic pill? Where is that? Yeah.
So it's not like having brain bleach and just getting rid of that situation that's causing you distress. Obviously when we're in a crisis, like we can have short-term crises. A crisis is also something we want solved right away. And there's two types. Like we have short-term things like, oh, I'm stuck in traffic. I'm not in traffic right now, so I can think this through. I know I'm realistically at some point getting out of the traffic and getting to work. But we also have like long-term crises that come up, like when loss happens, or let's say we're diagnosed with, a chronic illness, or something changes on our body and we have to acclimate and dealing with it for the rest of our lives. It's, distress tolerance, tolerating our distress is a lot about accepting where you're at. I talk a lot with my clients, and at STLDBT, the practice that I contract through, we really work with clients, those courses that you were referencing, on helping them build a balance of acceptance strategies. So like mindfulness, awareness techniques, to get in the driver's seat to help you recognize when you're in a crisis. But tolerating a crisis is also kind of accepting where you're at. So I always say, if it's like a bird with two wings and you want to change your emotion and you're like, all right, let's get out of here, but you're not getting really far. If you're just focusing on change and you're not accepting where you're at, there's not really a balance. And so being able to tolerate that moment, being able to work on one problem, you have to be able to set other problems aside. You know, you have to be able to kind of look at this exact paradigm. Instead of avoid, we would tolerate. Instead of the problem behavior, we would have problem solving. And then that helps us lead to that long-term relief. Now let's keep in mind, same cue, same emotion. Like, we're never trying to directly change the emotion. Our emotions are energy in our body. They're serving many functions, which we could probably talk about for a long time in itself, and we may get to today, you know, but we don't necessarily want to get rid of that. I have many clients that are like, I don't like this emotion, or I don't like emotions. Well, it is a love-hate relationship with them. You know, but as you can see,
it's a love-hate relationship.
As you can see, we're keeping that cue and emotion, but we're tolerating instead of avoiding, problem solving, which helps us get long-term relief and decreases our vulnerability. So how do you tolerate? Going back to mindfulness, you know, we teach a number of mindfulness skills in our groups, you know, but we focus initially on observing, which is just noticing, describing, which is labeling what we notice, and participating, which is leaning in.
Can you give us an example? Like, yeah, think like, if you could just think of somebody and kind of walk through that whole,
Yeah.
Example of a patient, like, not, you know, just kind of fictitiously.
Yeah, I have actually, let's say I have something on top of my head, you know, my dog, we had to put my dog down last year. And obviously that was a cue. Obviously I had an emotion. I, of course, wanted to avoid that. That was painful. That was uncomfortable. My problem behavior, to be honest, was probably getting a little cranky. It's a lot easier to feel anger. I'm mad at this, I'm mad at that, than it is to sit with that sadness. And so that made me feel better in the moment. But when I tolerated it and I sat with that sadness, so I first had to notice it. Some things are easier to notice than others. Like, obviously, Donna, if you're like, hey, Bridget, notice that picture behind you, I'm going to just look at it and probably turn back to you, versus something that flies by our life, like someone passing away or something really difficult to happen. It can be hard just to notice. You know, so an example might be saying, like, instead of saying like, oh, I'm sad, this is awful, I'm miserable, saying something like, I notice I'm sad. That is allowing, you know, what you used to tell your kids when they're growing up, stop, look, and listen before you cross the street. Observing and describing is like stop, looking, and listening. And then you can participate, which is crossing the street. And so when you notice what's going on and you label what you're observing, because we can only observe with our senses. Right. And so, you know, when we label that and we kind of put ourselves in this more effective, safer place, we're crossing the street effectively. We're participating and taking on that problem more effectively than we were if we just kind of ran in. I always think of like Frogger too, that game. Yeah, being an effective Frogger player.
That's funny. So as far as being mindful, so we're sitting in the feeling, and the feeling is painful, and we don't want to be in the pain. We want to like go to a behavior, which is usually anger or avoidance. Like for me, it's get busy and do something, clean up something, do something else. To sit in that, like, then what do you do while you're sitting in it? Like, what do you do with that?
Yeah. So, you know, that brought us to that tolerate point where instead of avoiding, we're tolerating. You know, then instead of the problem behavior, then we problem solve. We might be hanging out there for a little bit. You know, keep in mind that short-term relief probably why we're doing something that, like, even though it's ineffective in the long term, it makes us feel better for the moment.
Oh yeah, being busy makes me feel so much better.
Right? You know, puts us in that
It's
sense of
like,
control.
yeah, it's just like washing it away. Although it isn't washed away at all until the next hour when it's, yeah.
And so that problem solving could look like a number of things. You know, it could look like, depending on where you're at, you know, let's say you're still in that crisis mode, it might, you know, be channeling some paced breathing, doing some tipping your body chemistry, which I will demonstrate at
Oh,
some
that'd be
point
cool.
in this video today, to kind of decrease that, you know, arousal in the sympathetic nervous system and activate your parasympathetic nervous system. So I would say when you're problem solving, you're utilizing a combination of skills that you can kind of creatively stack for yourself. And it obviously can be a trial and error and a learning process, you know, but to activate that emotion regulation state, which is our parasympathetic nervous system. That helps us overall work towards, you know, living a more balanced life in the long term when we are in that emotion regulation state.
Mhm.
And so in addition to tolerating your distress with like paced breathing or tipping your body chemistry, there's also some emotion regulation we can utilize, like, you know, accumulating positives. Let's say, you know, with my dog, you know, it might be, you know, looking at a picture and thinking of the good memories. You know, if that's too much, then maybe it's journaling, you know, maybe it's talking through with someone. You know, there's not going to be a right or wrong way when it comes to figuring out what to do instead.
Yeah, isn't that interesting?
Mhm.
Hmm. So we've kind of talking a little bit about sitting with it, being mindful. Is there a particular breath work that you like to teach people?
So we really focus on, I'm going to kind of tie in the tipping the body chemistry
Okay.
skill as a whole because it actually has 4 letters, and one of the letters is paced breathing. And so so it's, the acronym is TIP. It
Tip
is
T.I.P.P.
TIPP. Yes, it's 2 P's. So that can get confusing, but it just adds on an extra skill, right? And
Okay.
so T stands for using temperature to tip your body chemistry. This is not to favor a skill, but one of my favorite skills, like to teach clients and to personally use, because you're kind of tricking your brain into calming down.
Huh.
So have you ever been upset, Donna? And like, not that you didn't want to calm down, but if someone was like, take a deep breath, and you're like, I'm not taking a deep breath, you know, we're kind of get stuck in that. Like this, even if you're willful and you don't want to use a skill, this is going to trick your mind into calming down. Um, there's a mixture of using temperature, cool specifically. So I have some ice packs to demonstrate with.
This is
Um,
fun.
not that warm water isn't helpful, but warm water is going to be more self-soothing. So if you are trying to tip your body chemistry, using the cold water is, you know, recommended. So it's the combination of cold water and or ice packs, bending over, and then holding your breath for 30 seconds. And when you do that, you're actually eliciting this dive reflex. So the same response that deep sea divers get when they dive down in the ocean, we're able to activate using ice packs, bending over, holding our breath.
I love that. I've done a lot of work with the sympathetic, parasympathetic, and when I teach patients in the office about how to do some of this, this is all part of the parasympathetic. So the vagus nerve, just for people who don't know, the vagus nerve runs all the way down our body, and it has like these little feeler things out, and it's what makes our heart rate go up when we're excited, and it's what makes our heart rate go down when we're calm. It's what makes our blood pressure go up when we're excited, and it's what makes our blood pressure go down when we're calm. It's what makes our breath go fast and shallow when we're excited, and it's what makes us calm down. So this vagus nerve runs all the way down our body. And what Bridget is really speaking to here is that what her technique is doing is really squeezing this out a little bit. And where those receptors are out inside the body, these particular things that you're getting ready to teach us really simmer down the fire and bring up the parasympathetic so that the body is starting to equalize itself and getting away from all that. So I just thought I would throw that in because I just love the physiology. Like it's so amazing. Yeah. So when you agree, that's what's,
Yeah, for sure. Yes.
yeah, so cool. So go ahead. I'm sorry.
Yeah,
I didn't
no,
cut
you're
you off.
fine. Would you like me to show the temperature scale right now?
Yeah.
All right, I'll do my best to be able to show myself on recording, but let me scoot my chair back a bit. And so you can do this with like a bucket of cold water. That can be kind of hard to get together when you're upset. But you can have like something always ready in your fridge. Like I've had people, use like cold Brita water. If you have a clean seat or a bucket, that works. I use ice packs because they're always readily available. Let's say you're like, what if I'm not at home? What if I'm at school? What if I'm at work? Have some stuff handy. Cope ahead for using this skill, or they sell those ice packs and heat packs that you can crack in your purse.
Yeah.
You can bring those with you too. Although it sounds silly, being in crisis doesn't feel good. And this is like a 30-second way to tip that. I don't have a Fitbit or anything fancy to look at it, but you can actually take your heart rate to be able to see where it drops. And so there is a video on YouTube of someone doing the tip scale, and in 30 seconds, the heart rate goes from 121 to 61. And
Wow.
yeah, so you can almost instantly feel the calmness. I practice this with clients throughout the day. And there's times by like my fourth time, I have to let them know I have to stop because I'm already in such a calm state. And
You're going in a coma. Sorry.
yeah, really rapidly reducing your heart rate. So if you do have any heart problems, or if you are struggling with being malnourished at all, always make sure to consult with, a nurse, a doctor, a nurse practitioner to make sure, this is a skill that's not going to be hurting you as you're using it.
This is so awesome. Like it's something I've never heard of. I mean, I've been in practice, I've been a nurse since 86. So the fact that there's studies and things going on about how this stuff works is so incredible that you actually get to experience this with your patients. So let's see what you got. This is so good.
So I typically just set like a timer.
Should I do my timer too?
Yeah. If you actually want to set the timer for me, Donna, and then I can just focus on the skill.
Okay.
And you let me know when to go.
Okay.
And then I will just be bending over and holding my breath.
Okay. You tell me what number am I telling you to stop?
30 seconds.
Okay.
And if you can't hold your breath for the whole 30 seconds, it's okay to come up and then resume holding your breath.
Okay. Do I start as soon as you put the ice packs on?
Yeah, you can just do 3, 2, 1, and I'll go into it.
Okay.
Okay, cool.
I get to be the practitioner.
Yep.
3, 2, 1. And up. How are you feeling?
I was a little nervous recording this, so I do feel a little calmer.
That is so awesome.
But it felt good.
So you put the ice on your cheeks?
Mm-hmm.
Oh, I'm gonna like get me some ice packs. I guess you could use like peas, frozen peas.
Oh, for sure. Yeah. Make little bags of ice. I've had clients, and I obviously the mixture of the bending over, the holding your breath, and the coolness is what elicits that dive reflex. But there also is power in like obviously splashing water on your face, taking a cool shower. Like that is going to be refreshing. But those 3 steps combined is what helps elicit that dive reflex.
So temperature.
So temperature is the T. Yeah. And we'll move on to the I. The I is for intense exercise or intentional movement. And so obviously exercise is also can be a mood booster and emotion regulation skill. But when we engage in an intense exercise, whether it's like 20 to 30 minutes of a walk or a run, or even, and I'll share my first experience with this, doing like a wall sit or a plank, something that's really going to make you focus on engaging your muscles, engaging your body, and, just really change that flow. So when I actually was going to school, and I had interest in being an art therapist in the beginning of grad school, and my elective got canceled that I needed. And so I just picked up the other class that had a good time, of course. That's what college students do. And it was dialectical behavior therapy, which is where we teach the modules of mindfulness, distress tolerance, emotion regulation, and interpersonal skills.
What a good mistake, huh?
Yeah. And the first 5 minutes of this class, and my classes were from like 5:30 to 10. So like long night ahead. This teacher is like, I want you guys to think of what's bothering you the most. And like she kept egging it on. And I was like, what is going on? Like, I kind of want to be calm. Like, I just worked all day. Like, why are we talking about this right now? And then she has us all get up and go do wall sit. And the soccer player competitive part of me was like, I'm not dropping. And so my mind completely goes away from what I was worried about. Although she prompted it and it was, placed, of course, for practice, I really did notice that. And so especially when we're like angry and like we're so angry that you really can't quiet it down, engaging in that intense exercise can be really, really beneficial and can also tip your body chemistry.
That is so interesting because those wall sits are hard.
Right.
And yeah, and when I can like while you're talking about that, I can like picture myself doing those in the past. And like the whole time you're like, I gotta get up, I gotta get up, I gotta get up. So I could see how that intense activity, that is so interesting. So I'm getting some good tools. Aren't you guys getting good tools? This is so good. Keep going. This is so awesome.
50 jumping jacks works, 20, I would probably do 20. One time we're practicing in group and I said 50 and I regretted that halfway.
I regretted that.
But yeah, the I is for intense exercise. If I'm ever working with someone that may, let's say their maladaptive coping skill is engaging in too much exercise, then we may talk about how to make sure it's intentional movement so it's not feeding into that avoidance more. Mm-hmm. So we want to make sure we are utilizing it intentionally and effectively.
So not cleaning the kitchen.
Well, I would say like if organizing, because that is moving and you are having, and if that's something that I think works for you, I definitely think it could fall under that category.
Okay, good.
I don't like cleaning, so that would put me in crisis.
Yeah, you got to figure that one out, don't you?
Yeah.
So go ahead.
No, you can go.
No, go ahead.
I was going to say, and so when we utilize intentional movement, intense exercise, so even if you're doing it, let's say part of your daily routine, like part of your routine and your structure is to move in some way, shape, or form a couple times a week. Although that might not be doing the same thing as like hitting the reset button, like you are automatically expanding your window to tolerate, things moving forward. And so by engaging in those things too in the day to day, I doubt you're going to want to like put ice packs on your face every day, but something like movement, it still is serving a purpose of also regulating our emotions when we're not in crisis.
Would you say, so sometimes I tell patients because I'm not a therapist, but like if patients come in the office and I teach them certain kinds of breathing exercises, I encourage them to use that whenever they go to the bathroom. Would you say kind of doing these tipping exercises like on a routine, like 2 or 3 times a day to kind of help temper? Because I think, I think more people are in this sympathetic more often than they're not. I think it's the phones, the computers. I think our lives are just so different than they were before. And maybe that's what I'm thinking from my age bracket, because like when I was a kid, we didn't have cell phones or computers, or we didn't have a television had 5 stations. So like we did things, we went outside, so I feel like the stress levels for you younger adults are so much higher. Do you think like doing a planned, maybe it's just a planned vagal, exercise 2 or 3 times a day? Or
I definitely would say, I tell a lot of my clients to practice in pretend mode twice a day if possible.
Okay.
Interestingly enough, Donna, I had training in DBT prior to obtaining the training in DBT for children. And it wasn't until I received the training in DBT for children where we use a tool called a diary card to kind of help enhance generalization and motivation to use these skills every day. But it wasn't until the kiddo diary card that they had on their practice skills twice a day. And so I started lumping that in for all age ranges, including myself. I'm clearly practicing the T.I.P.P skill often. I just did it on screen. And I definitely notice a difference on the days where I'm leaning down and doing T.I.P.P all day versus not. So yes, I would definitely say practicing in pretend mode. It's not only going to expand your window, but it will increase the likelihood for you to utilize that when you are upset, in distress, or in crisis. It's also going to be like a lot easier to buy into if you've done it before.
Is there like a long-term effect? It's just helping you cope better with life by doing these twice a day. I mean, it just makes sense to me that that would be the case.
Well, I think, yeah, definitely long-term effects, because it's helping you elicit those tranquil functions of the body.
I love that, tranquil functions.
You don't have
And it's not Prozac, not that it's bad, because like I've used, all those medications for 18 years and they do work. But I just feel like creating these tools like what you're doing and getting them in these young children so that these kids, like, why are we not doing this in grade school? Why are you not teaching this in kindergarten so that we learn this so much earlier and we don't wait till we're in a problematic place where like, oh, what do we do? What's a crisis? And then you think like every therapist doesn't do what you do. So a lot of therapists, like in like if the older people like go to therapists, they're just getting talk sessions. And like, that's just what you're doing, like is an active involvement of engaging that parasympathetic, like it's so much better. Like it just makes so much sense to me. Yeah. So
I have a lot of clients, even kids that are pretty burnt out or jaded on like the therapy process, and helping them to, build the awareness after, of course, getting to know me that like, hey, there is going to be a science behind these that will help you. And, I know when you've been told to just breathe before and you're like, don't really care to use that anymore because it hasn't worked for me. And so it's really getting to know, what it's doing to your body. Because there might be times where you're in crisis and you use this skill and you most likely aren't going to feel like $1 million after. But what it's doing is, let's use like when a firefighter puts out a fire in a house. They don't run inside while the fire is going. And they're not like, where's that curling iron? Let me straighten this picture. Like they're not going in and cleaning up. They put out the fire and then they're able to go in safely and like do the work from there. So when we tolerate distress, using the T.I.P.P skill, something of that matter, it puts us in a safer place to go in and do that work further.
Nice. So we got T.I., now we got a P.
Yes. So P, there's 2 P's. So we'll start with the first one, which is paired muscle relaxation, progressive muscle relaxation. There's a number of different ways to do that. So it's pretty much, when I work with kiddos, I call it tensing and releasing, or tensing.
I love that one. That's what let's do one together.
Yeah. Do you want to facilitate it, or you want
No,
me
you go ahead.
Okay, cool.
So definitely you're learning today.
Let's do like toe to head. So get in a comfortable seated position. Just take a big deep breath in and out. And let's start with our toes, okay? Let's start with our feet. I want you to tense and clench your toes as hard as you can. Breathe in and we'll count to 5. 1, 2, 3, 4, 5. And release and breathe out. Next, we'll move up to our legs. So let's tense our legs. We'll breathe in, hold for 5. 1, 2, 3, 4, 5. Breathe out and release. Next, we'll move to our hands. And so I typically put my fist up and tense for 5. 1, 2, 3, 4, 5. Release.
Doesn't that feel good in your hands?
Feel it. Yeah.
Yeah.
Can also bring in our shoulders. So tense our shoulders up. 1, 2, 3, 4, 5. Bring them down. And I usually end with my face. I'm not gonna be able to count this one, but let's squeeze our face for 5 seconds.
This is a real cute look. So go deep
We're
on this.
gonna look real good here. All right, go. And release.
That part I'll be editing out of the video, just saying.
Well, but as we went through that, I felt my head relax, my shoulders drop, my jaw was more relaxed, and it kind of just creates that flow. And so you can do something like a body scan that's toe to head, head to toe,
Mhm,
or you can also, pick certain muscle groups.
mhm.
They have ones, you can also find guided, guided practices on some of the apps or on YouTube that can kind of walk you through that. If, walking yourself through that is, not as easy. I typically will listen to something when I am engaging in it.
Yeah. Yeah. It's so much easier that way. I like that.
Mhm.
That felt good. Thank you.
You're welcome.
Okay. Next P.
Next, we have the last P, which is paced breathing. And obviously, when you're doing the paired muscle relaxation, you're pairing it with in and out breath. Paced breathing is one of my favorite coping skills, in addition to the T and tip, because we always have access to our breath. We always do. And it's not really something that other people have to see you utilizing as a coping skill. So I always tell kiddos too, this is something you can do in class. And it really does help. And there's so many ways to do it. There's flower breathing for kiddos where you can imagine your favorite flower. And when you open it, it's blooming with your in and out breath. You can do star breathing. But the whole goal with paced breathing is making sure it's paced. Breathing in and out, typically for longer. And then making, sometimes doing like 5 to 6 breath cycles per minute. That personally is hard for me to follow. So I typically will follow something that's like a count. So like breathing in for 4, out for 6. You can do box breathing, which is breathing for 4, holding for 4, breathing for 4, holding for 4. I also recently have been just doing nose breathing. So breathing in through my nose and out through my nose. And then just when I'm breathing in my head saying in, and when I'm breathing out in my head saying out. And I have found that really calming as well.
Yeah. Yeah. I like all of those. Yeah. I do heart math. And have you heard of heart math?
I haven't.
So heart math is breathing in and out through your heart. It's the same box breathing that you're talking about. So in for 5, hold for 5, out for 5. But during that whole time, you're like picturing somebody you love, and you have your eyes closed, obviously. And on the out breath, you're sending that person love. And on the in breath, you're bringing love to yourself. Because something I think we also have a hard time with is receiving love. We're so easy about like giving stuff away or doing things for other people, but we don't often think about why they love us too. And we just should sit with that love as well. So like it's a really, I do that in the meditational parts of the stuff that I do at the practice. But yeah, it's so amazing. The breath work is so amazing. And I'm sure you would speak to, you can do that in the bathroom. You can, like you said, in the classroom, nobody notices that you're doing it. And it brings you down from that fast, shallow, and it starts to open up that lower abdomen, which really pushes it all down. Yeah, that's good stuff.
That heart math reminds me of one of the mindfulness skills that we do teach in our skills group called loving kindness.
Yes. Yeah. Yeah.
Yeah. So focusing on sending that love and compassion to yourself, to others, and the world around you. And
Yeah.
so, yeah, I really like that with the breath, though, breathing in and out and sending those warm wishes in that way as well.
Yeah, it is awesome. So
Mhm.
how do you, so like you're kind of putting it all together, and it sounds like this is a great process. You do behavioral therapy as well?
So I do dialectical behavioral therapy, which is where the T.I.P.P skill originated for
Mhm,
like the T.I.P.P acronym. And so dialectical behavior therapy was created in the 80s by Marsha Linehan.
mhm,
And it's really heavy on, behavior therapy, was pretty heavy on change strategies early on. And so dialectical behavior therapy balances in the acceptance and change. So it's really about when I'm working with a client, the relationship is treating them as an equal. We're in a rowboat and I'm not sitting back just making them do all the work, and they're not poking holes in the bottom as we're going down the stream. And
mhm,
so it's really, balancing that acceptance of I'm doing the best I can with what I have, and I'm willing to do better to try harder to make a change.
mhm,
And so we focus on not just accepting where we're at to elicit that change, but also building up the skills and building mastery around the skills in the day to day life. And so dialectical behavior therapy, although you're meeting, maybe I would say 2.5 hours, 3 hours a week tops, it does ask a lot of you because each and every day you can pencil these skills in. You can apply these skills to your day to day life
mhm.
to build that mastery around them. And sometimes they work and sometimes they don't. And so we have different strategies to help measure and cut to figure out what to do instead. So a lot of times too, if I have a client that's acting on a problem behavior in between session, we'll kind of go back and say, hey, like what did we have? What did we not have? What's the missing link? What skills did you try and did they work? And if they didn't, what can we try next time? Also looking at kind of going back to that short-term and long-term relief, you know, looking at what is giving us the short-term relief, but with long-term consequences versus what might be short-term uncomfortable, but creates that long-term relief.
Mhm. Yeah, I think everybody needs this. Do they do this for adults too?
Yeah, so DBT actually was created to work with suicidal women, and it has since trended to be applicable to a number of diagnoses, a number of age groups. The children piece is very, very early on and new, but it's
Mhm.
quite fabulous because what it's doing is working to prevent that psychopathology from carrying into later adolescence, young adulthood, which is one of the reasons I feel like I'm so passionate about it. Because, like you said, where was this when we were in middle school? That was one of my first thoughts. Like, where were these skills when I was a kiddo? When I was in high school, we didn't learn those things. We
Yeah,
didn't.
which I think is so like that's why I feel so passionate about this too, because like nobody knows these things. I mean, nobody knows things about that even diet can help with stress and anxiety. And I know you have a little bit of a story to speak to that too. Um, but like as adults, there's so much more. Like besides just doing the laundry and the dishes and making sure everybody gets off to school or whatever, we do need to be doing some self soothing techniques during the day and really penciling, like you said, pencil it in. Like
Mhm,
we need these things, otherwise we're going to go nutty.
mhm.
So kind of speaking a little bit, what my favorite thing is kind of functional medicine and how you're like, I think it is okay to speak to your journey a little bit
Of
about.
course, of course. One more piece to that question about it does this work for adults? Of course, we there's adults. It's very common, to have adults in DBT. When I do work with kids and teens, heavy on the parent work. So because parents are spending way more time with their kids than I am. And
Mhm.
so helping the parents to become their own coach. So when the kids going home and implementing those things, they're like, not like, what's going on? I think it was one day before I had this training in DBT for children where I had a younger client be like, you really think I'm going to go home and use this, Miss Bridget? And I was like, I appreciate the honesty. And so without, that change ready environment, it makes it really hard we can't unlearn a behavior. So that prior, learning and reinforcement allows that to stick for the kiddos.
Yeah.
Mhm.
I think, I mean, how often do you go to anything where you're teaching the kids, the parents, and getting everybody kind of on board? I
Mhm.
mean, I don't think that a parent can do anything if they're not learning it too.
Mhm. Mhm.
So let's, and then did the parents come to classes as well?
Yeah, so I actually, the way we have it set up at STLDBT is the first 8 to 10 weeks is the parent, like they get everything they need. They get acceptance strategies, change strategies. They have access to coaching calls in between session for crisis
Oh,
situations.
amazing.
And then we, tie in the kid. And it's been pretty cool to see like how effective having that environment ready is. It's actually pretty neat. Because then once the kiddo is learning the skills, so when the kid joins individually, there's also, we have preteen and teen groups that have the parent in them as well. We're practicing the skills together. They have a level of willingness and buy-in already. And then we're practicing them in the same place they have crisis. So I'm having them grab ice packs during the group and try it. And so it's really allowing them to build mastery without also having the parents have to like practice your skill today and
Yeah.
things like that.
Well, it seems like they'd want to do the skill if they
Yeah.
feel better with it. Yeah. I don't
Mhm.
know. Like I'm so impressed with what you're doing. Like to me, it's just, I just like want everybody to hear this. Like, so if anybody's watching this and they think it's helpful for other people, just keep passing it along, passing it along. I think it's our job, it's our duty to see things that help people. And then it's our job and our duty to pass it to somebody else because this is so much bigger than us. And if it doesn't work for you, it might work for somebody else. So again, like really taking the initiative to send this to other parents that need education, that are struggling with their kids or kids that are struggling. There's no reason why we should be losing our patients. There's no reason why every day we should be waking up and feeling so horrible on the inside when we are such blessed and beautiful individuals. So like what you're doing is just flipping amazing. Like I'm just so glad to hear somebody's doing an activity and teaching a skill instead of just talking and trying to talk through all these childhood traumas, which I feel like reinforcing those things in our brain sometimes. So it's like I need something right now. And this tip just sounds so amazing, Bridget.
And if we try to uncover trauma and do not have the skills to take it on, it can be quite scary. Like it would make me want to shove it down even more. And so being able to put out that fire so then we can safely go in.
Mm-hmm.
And thank you, back at you with the work you're doing.
Yeah, that's amazing. So is there anything else that you'd like to add today?
Yeah, I know you asked me about my functional medicine journey.
Mm-hmm.
I, coincidentally stumbled upon it. I went to a CEU event. I want to say it was about a year and a half ago. And Dr. Jason Wibbenmeyer, who you know, of course, as well, was there and speaking, and just his story on how he was infected by his anxiety really related to me. And it's something that was kind of a personal goal of mine for a long time, to get to know the functional medicine process. So also when I'm referring clients to do it, I'm also, having my own experience. And so I learned a lot about myself. I learned how the stress was affecting my body in ways that I didn't know it was ever affecting my body. And so I have since, made a lot of lifestyle changes that has put me in the driver's seat when I do have stress a lot more. And I was already doing a lot of work. And so taking that journey helped me really measure and cut, because it kind of got aggravating when I still had different, stress symptoms that I know now popping up, because I was like, what am I doing wrong? And it wasn't that I was doing anything wrong. My inflammation, my body had a lot that we needed to put out that fire to allow us to really, kind of, open up the door and help me feel like myself. And it took a lot of work, on the front end, but I can promise you that long-term relief is worth it. And I was going to a traditional doctor for one of my symptoms, and I was getting prescribed something that I felt like was a Band-Aid. And it was also giving me symptoms I didn't like. And I have since been able, not that I was on a ton of medications, it was two, but I'm not on those anymore. And I've been able, I think I would have been on those for a very long time if I never would have went back around and figured out that it wasn't what we thought it was. There was something fueling that from within.
Yeah. And I guess like that's kind of what I feel as far as a specialty is helping patients who are having physical symptoms that are coming from stress by implementing diet, NutriCals, doing some gut cleansing, or doing the stress work that you're talking about, doing water, which so many people don't even drink water. It amazes me. So anyway, like looking from the functional medicine, so it sounds like what you were doing was changing your diet, adding in some vitamin supplements, doing some bowel cleansing, and then doing the work that you know to do professionally. And then that is a combination got you to this place where you were able to get off some of your medications. Is that kind of how it, yeah, I know.
And doing it are two different things. So like having to really lean into the emotional work myself, you know, knowing I was doing the physical piece, that's never really been hard for me. If my doctor tells me to do something, I'm going to do it. But when it comes to like applying some of these skills, I really had to lean into that and be willing to get to know that. And, you know, I have a meditation practice now at this point that I do daily, and I can notice when I don't, and the people around me notice too.
Yeah, yeah, I love it. Well, I love the work that you're doing. So how would people find you if they want to work with you?
Yeah. So if you're interested in doing one of the DBT programs, you can go to stlouisdbt.com, and that lists all of their services, our services there, from children to adult age, groups, individual therapy. And then if you're looking for individual work through Bridge the Gap, then you can go to bridgethegapstl.com.
Bridge the Gap. Bridge the Gap, what?
STL.
STL.com. Can you just say those one more time for this? Yeah.
Yeah, of course. So St. Louis DBT, so stldbt.com is the DBT practice I contract through, and then Bridge the Gap is my practice. So bridgethegapstl.com.
Awesome. This is so amazing. So for everybody here, I just want to thank Bridget for coming today and sharing. I feel like they're gifts, like just beautiful gifts that each of us can start to incorporate, from the wall sit to the tip, to the cold packs, to the breath work. Like everything you talked about here today is about us taking 100% responsibility and trying to step up our game so that we can begin to heal ourselves and teach other people to do the same. The work you're doing is obviously making a difference in the world, and it's such a joy to me to be able to share you with the world. So to you, thank you very much for coming in today. Yeah, this is going to help a lot of people. So I just want to say this, thank you for coming. Donna Nauman, if you decide you want to do some functional medicine stuff, you can find me at donnanauman.com. Thank you to you, Bridget, and I appreciate everything that you're doing.
Thank you, Donna. Thank you very much.
All righty. See you next time.